Yo, smell anything?
No.
I think I myself.
Severe head issues, that's definitely hypovolemic shock, and vampires pushing through injuries that would drop a real human in seconds. In honor of all the recent Oscar nominations, today we're reacting to Sinners and breaking down the medical reality behind the violence, the physiology, and the moments that cross the line from dramatic to medically impossible. Let's dive right in. Oh, nice. Oh, when people are on fire, obviously you're in extreme pain first. We have your degrees of burn. First degree, second, third, and that rare fourth degree that doesn't really get spoken about very often. Your first degree burn is the burn that you get from like the sun, or you spill hot water on yourself. There's two different categories of second degree burn, deep or superficial. Third degree burn, that skin has just been burned to the point where the nerves and the blood vessels are gone. Fourth degree burn, that's when things get deeper. That requires a significant amount of reconstructive surgery. They always go for the jugular. It does make sense.
That actually makes sense.
It is easy access, not that deep. The jugular vein is a big, thick vein, probably as thick as maybe your thumb or an index finger. The carotid artery is maybe your pinky or a little bit smaller than that. Usually the vein sits more superficial versus the artery is a little bit more deep. Whoa, a lot of the red stuff just pouring out and actually hit on the right side of the chest, but maybe at a more central angle. Could you get the heart? Yeah, you could potentially get the right atrium, the superior vena cava as it comes down on the right side, or the inferior vena cava as it comes up. Gunshot wounds to the head. I mean, it kills the vampire, but probably would kill anybody. Going directly sideways, you're hitting both hemispheres, so it's a lot more detrimental than if it was going directly through one. Oh, stab wound to the clavicle, right upper quadrant of your lung here. Underneath that is your subclavian vessels. If you have bleeding or injury to that blood vessel, you can't compress it. The bone is in the way. You can bleed out pretty quickly from that area. Oh, is that like holy water or something that then burned his face? Almost like acidic burns, you know, hydrofluoric acid, sulfuric acid. Those are kind of bad ones. Hydrochloric acid, you don't want to have on your skin. So just be careful if you're ever working with chemicals. Oh. Oh, they did a good job. Okay, we got slow pulsatile bleeding. Finally, we see true arterial blood. We all think arterial blood should be spraying across the room, but if your blood pressure is already low now because of hypovolemia, you're not gonna have a ton of pressure, so it's actually gonna be a lot slower of a fountain of blood, but it is pulsatile, so we know that that is arterial versus just a stream, which is venous. What do? Direct pressure to the area as best you can. Don't collapse both sides because you're gonna decrease blood flow to the brain. It's gonna cause the person to have brain damage. Try to compress as much as you can. Fill that hole up with gauze, cloth, whatever you can. Stick your finger in the artery if that's what you have to do to get the bleeding to stop. Oh, geez. It's not what it looks like. You are covered in the red stuff everywhere. I guess they're not really worried about bloodborne pathogens. Things that we think about, especially at the hospital with like blood exposures, would be hepatitis B and C as well as HIV. Lots of gunshots, but doesn't work. Yep. Look at the eyes. The eyes are cool. Normally for us, when we shine a light in the eyes, you actually have a red light reflex.
We're gonna kill every last one of you.
Vampires have the very large canines, so we all have canines, the sharp teeth that we have, but the vampires have big ones so they can stab into your neck. Oof. You see her running out. We got multiple bullet wounds. I've seen plenty of people shot multiple times, and sometimes it misses every vital organ to where they can still survive versus just one gunshot and they succumb to the injuries.
Do everything.
Nice. Oh, they're all connected to him. Cool. The question ends up being, in real life, do twins like sometimes feel the pain, or do other people feel other individuals' pain? Are you that empathetic? Let me know in the comments if you've experienced anything like that. If you were just a normal person and you took a blade like this in your head, that's going through your brain tissue. That is in the left side posterior aspect, partially through your temporal lobe, maybe your parietal lobe, and part of your occipital lobe. Maybe gets all the way down to your cerebellum, which is the balance center of your brain. On the lateral sides of your head, you have the middle meningeal artery. When that gets hit or injured, we always worry about epidural hematomas and compression into the brain. This could be hitting that as well, but you'll be bleeding into that area. If that's the case, hopefully the dura is separated already and it's just going to bleed out versus causing more compression to your brain. What happens here? Oh, staked. Right through the heart, right through the sternum. I mean, these pieces of wood are super sharp if they're going through that sternum like that. That's crazy. I like that actor. Oh! Oh, right. So with vampires, you have to invite them in.
You silly boy?
If horror movies like Sinners has your nervous system fully activated, you're not alone. It's actually why I created Chillax by my company Life Happens, designed to help calm racing thoughts and bring your system back down when things get intense. You can find Chillax at lifehappens.com or on Amazon. Oops, his buddy is turned. Wow, you see the gunshot right through the mouth. So really interesting. You can see right through the jaw or the mandible. People will do shots to the face and will have injuries, but they're survivable. We may need to intubate this person because of all the blood bleeding into their mouth and airway compromise. Reconstructive surgery would need to be done.
Hey. Hey. Yo, smell anything?
No.
I think I myself.
This actually happens at the hospital quite often. Well, people, for multiple different reasons, either you died and you came back to life, you passed out, you're having bad GI issues, people do poop their pants.
I think the principal pooped his pants.
Thank God for the hospital staff that is able to help clean up patients. If you like this movie, let me know in the comments. Definitely check out this playlist right here, binge watch everything. And as always, do me a favor, please make sure you subscribe, turn on your bell notifications, and hit that like button for me. Thanks so much for watching, and stay healthy, my friends.